Medical breakthroughs are improving our lives almost every day. One of the most exciting and fastest growing areas is the use of stem cell. But what are they? Where do we get them? How do they work? Well, Dr. Bill Johnson of Innovation Stem Cell Center is here with all of these answers. We're happy to have you.
Good morning.
Good morning. Okay, this is an interesting topic. What are stem cells?
Well, stem cells are body cells that do almost all the healing, and they have two qualities that most cells in our adult bodies don't have. One, they can make new copies of each other. So if I have one fat cell and it's a stem cell, it can become another fat cell. But we can actually make many copies. So we have the ability to make as many copies as we need based on how many we want. So that we can have all that we want. So once we have one, we can have as many as we need. But the other thing they can do is they can become other types of cells. So if these represent cartilage cells, they can become cartilage cells.
Very nice.
And make as many copies as you want.
Okay.
And they can become lung cells and make as many copies as you want. They can become neurons, neurologic cells, or swan cells that create myelin to coat the nerves. So whatever we need, these cells have the ability to make. So what we're doing is harnessing that power and putting it in places where our body does that poorly or not at all.
Okay, well, how do we get the stem cells in the first place?
You know, we've had some Facebook posts recently and people are still worried about embryonic. We're not talking about embryonic stem cells. We're talking about stem cells from you. We're talking about using your own stem cells on you. You can get them from many tissues, but in the United States, by far the most common are bone marrow and fat.
Okay, and so we're actually harvesting them from fat instead of bone marrow. Why is that?
Well, the reason we prefer fat is when you harvest bone marrow and you do a really good job, you can get about 60,000 cells. That's a good harvest from bone marrow.
A lot.
If you do fat, we average about 100 million cells on average that we can get. So we get about 1,000 times as many cells. So not only is liposuction a little bit easier than a bone marrow biopsy, but we get many times more cells. And since we're not growing the cells right now in the United States, we're using them the same day, then it's a great thing to have more cells.
Okay, well, so we're getting a lot, and then they multiply as we're getting them, but how are we using them? What are we using them for?
Well, we have a large number of protocols that we use under what's called an investigational review board. So we have this independent board that looks at what we're doing and approves our protocols. And we do a lot of folks, we do osteoarthritis is the one we've done the very most. So wear and tear arthritis, knees, hips, and about 85% of the time patients are responding, and a lot of folks are able to avoid knee replacement. We're doing an independent study on our own looking at treating COPD or emphysema with stem cells, and we're starting to see some change over time. The people get slightly better over time instead of gradually worse over time. So it's pretty exciting.
This all sounds very exciting, very interesting also, but I'm curious to know, once we get the stem cell and we put it where it needs to be, how does it know what it needs to do and where it needs to go?
Well, we have each one of these disorders we treat a little bit differently. So if we do your knee, we're going to put some in your knee and some in the vein. If we're going to do your lungs, we're going to put some in the vein and have you breathe some. But what really is going on is the injured cells release messengers called growth factors, and those growth factors attract the stem cells to where the damage is and turn them on, telling them what to do. So that's where relying on your body's own internal system to tell the cells what to do and where to go.
How long would recovery take if we maybe had that done to our lungs or maybe even our knee, as you mentioned?
Well, the recovery is strictly about the small area of liposuction that we do to do the harvest. So recovery is quite simple. We get a little bruising, maybe a little swelling in the area, but most people go to work and do anything they want the next day because we're only talking about an area about this big that we use for the harvest.
Wow, little downtime. That's what people like to hear. But you mentioned arthritis earlier. How about some other disorders that would be great for stem cells?
Well, we have protocols on a lot of neurologic diseases as well, like peripheral neuropathy, doing very well on. We're doing some Parkinson's, Alzheimer's, doing some folks with strokes and brain damage, seeing some results in those.
Wow.
We're doing a lot of urologic problems like interstitial cystitis and erectile dysfunction, having some nice results there. We're doing some hair loss. We're doing some folks with heart failure. So we have a lot of different protocols, and we have the ability to do different protocols for different problems, so there's a lot that we can address.
So you said that the downtime is little to none, but how about how long it actually takes?
Well, we typically, depending on what disorder, but the typical, again, we go back to a joint. When we inject the joint, we often see a real immediate response. A day or two, see a lot of improvement in pain. And then that tends to plateau for about 3 months, and about 3 months we start seeing further improvement. And folks can continue to see improvement all the way out to a year.
This is something I'm telling you, Dr. Bill, if I could have you here all day, I would. We're skimming the surface right now, so I know you probably have a few more questions. I'm going to encourage you to call Dr. Bill Johnson with those and come in for a consultation and just have that conversation with him. Here's the number. It's 214-669-6948.